Now I'm going to show you how to set up your own hydrocollator unit in your own practice. We'll just spend a couple minutes on this because not everyone will purchase one of these or have access to one of them. We just purchased this one in November 2022. It's shown here on Amazon for $495 right now. These used to be a lot less expensive. They used to be only like $250, $230 forever. And then COVID hit and everything, all costs doubled, right? If you notice, it says about this item, the Hydrocollator E1 stationary, and hydro stands for water. Hydro is water. So this is a hydrocollator and it's coming with 4 standard packs. It says plus a net hot pack, but ours did not come with a net hot pack. So these are what your packs look like when you originally receive them. Okay, they're filled with clay. I think it's called bentonite clay, and you can see how thin they are. They used to have a little bit more clay material in them, but they kept on ripping and tearing the canvas. So they don't have them as filled with clay as much anymore. You're just going to take your packs. There will be a little bit of a kind of like a library holder, like you'd put books in it, but instead you're going to put your packs in it just like that. You want to fill that with distilled water. You don't want to use regular tap water out of the faucet because that has bacteria in it, and bacteria can grow in that tank. Remember, the tank heats up to about 150 degrees. Now, usually we would place for low back placement, we'd place that hydrocollator pack right over the towel. But I'm going to show you really quickly. You can see her skin here. It's even toned. There's no redness or anything. That's where we're going to put the pack. We're going to put it right over the low back where she has some chronic low back issues. We're going to show you, look at how thick that pack is now that it's soaked in water. And we have several layers of towel there for you. That's just a large bath towel that's folded in half and then folded in half again. They do make these terry towels that have Velcro inside of them so that the hot pack doesn't slip off and fall on the floor and get dirty. But they're also very expensive. So we just usually use terry bath towels with ours. Now I'm going to show you what it looks like after we've had that hot pack. I changed it around on her back and checked the skin once to make sure it wasn't too hot. And you do need to check in with the clients when you're using thermal therapies. Make sure they're comfortable. There are contraindications. You would never work on neuropathy and stuff. See how nice and pink the tissue is now? It's warm. Now I'm going to show you some myofascial techniques. You shouldn't be attempting these on your own. We're just going to do one instructor demo here. Just to give you an idea, if you're myofascial trained, you should be able to practice along with these or use these as practical examples for your myofascial practice. If you're not trained in fascia body work, you should definitely consider in seeking that training. We're just going to rock the spine here after a little bit of palming because releasing fascia in athletes is a great way to increase their mobility and release pain and probably improve function. So on the other side, we're not just treating the side that hurts or has pain. We're going to do a little bit of traction and some myofascial work here as well. And we're just basically pushing through areas where we feel that there are fascial restrictions through the thoracolumbar fascia here. And the tissue is so much more pliable now that we've heated it with that hydrocollator unit. So I'm getting some nice stretches on there. What I'm going to do right now is some more myofascial work. This is called J-stroking. And with J-stroking, you're just closing your thumbs and fingers, 2 fingers together to try and stretch some of that more superficial thoracolumbar fascia. Now that we've stretched it, maybe we can separate some of those tendrils. And I'm going to do alphabet stroking. This is a little bit of a pin and stretch on the skin itself. And I'm going to draw a different alphabet. I just braced my fingers. And the tissue is much more pliable after you heat it. So this is a great time to add myofascial techniques. Of course, this is not practiced at a sporting event. This is something that you would use with your athletes in your private treatment room and your private practices to treat chronic injuries. Usually heat with a hydrocollator pack for acute injuries. This would be somebody who has an old sports injury and is just trying to rehab it and get over it, so that they can get back to competition, get their full speed, get their full strength back. Think about adding thermal therapies in addition to the body work you already know or practice, or learn more body work to help release tissues, reduce contractions, and increase range of motion. All of that is going to help with your athletes for sports massage.